Recording. Stop the recording for now. Recording. All right, so we are starting this group session, and I mentioned that we already discussed loads of common questions, and later in this webinar, I will probably have you guys, just rehearse some of your answers. But today, I think we should focus more on ethical questions and situational questions that we are seeing that they're asking more and more, and I think that's going to be important. Let's try this view. Start. All right, what do you guys think? It's good? Okay.
Yeah, this is fine.
Okay. So yeah, so I'll probably present like we always do. I'll probably present a few questions and answers to get the ball rolling. And then, we can go into back and forth and any question that you have, and we can go into the details of some of these questions. All righto. So let me do this view for now, speaker view. Okay. All right, excellent. So what am I being shown when I'm talking? Am I coming up on the screen?
No, actually.
Yes, sir.
But
we can see you.
When you're talking, I can see everybody, but not specifically you.
Okay, interesting. All right. All right. Anyways, we'll see what happens. Anyways, so let's get going because everybody's time is important and people need to prepare. So, just to show if anybody doesn't have this, where is this? Let me share my screen. Let me get here. Anybody doesn't have this, I'll just share it, no issues. Give me a second. Websites. Oh, no, not this. Okay. All right, so let me share my screen. All right, share my screen. Where is this? Okay, it's always difficult to find the right screen. All right, so if you want to get ahead with your preparation, most people probably have their answers ready. So if you have loads of answers, Q&As, and every question has multiple answers and templates. So for example, this for pediatrics, family medicine, internal medicine. So whatever your specialty it is, you can have some idea of the template answers. And of course, we have sample video how you will be presenting your answers. So anyways, stop sharing and let's get to this program. All right, so let me just do this one. Okay. All right, so I'm going to go over some ethical questions as well as situational questions. So and this happened with me. I was a third-year resident, and one of my second-year residents. So you have a team in the hospital, right? You have interns. Let's say in internal medicine. You have intern first year, PGY1, PGY2, and PGY3. So I was the PGY3, and my PGY2, she was being late every single day. And you have to be ready for the rounds at 7 o'clock or 8 o'clock in the morning. And you have to see all the patients, and you have to get the computer ready. You have to get the charts ready, a lot of things to do just to make sure, things are ready for the attending. And this resident was coming in late. She would sit behind and try to quickly look at her patients and then come in for the rounds without helping the team out, not being a team player in a way. But anyways, so this was a question that somebody said that was asked today in the interview. And it's so interesting that, it's almost the same situation. So the question is that if you notice that a resident or an intern was consistently coming late and not seeing their patients or not being ready for the rounds, how would you handle the situation, right? So this is an ethical situation as well as a situation that can really happen and happens a lot. Happened with myself a couple of times. And so the way you will answer it, let's talk about this. So good question. And I noticed that if a fellow resident was consistently late and not seeing their patients or not ready for the morning rounds or not helping the team out, my first step will be to approach them on a private basis and in a non-confrontational manner. I want to understand if there's any reason that regarding this behavior and perhaps they're dealing with a personal challenge. They are unable to get into the hospital early enough. I might say something like, hey, I noticed that you've been running a bit late recently. Is everything okay? And I will let them, talk about it, and they should realize that, hey, this is not acceptable. If this continues, then of course I would not address it on the second time around with them. I would directly talk to my superiors just to have them address it, and maybe there's something else that they can talk about with that individual. But of course, we need a proper decorum and timeliness when we are rounding or for any matter in medicine. So that's going to be your answer. I had different situations in residency when I was the intern, and I was managing the ICU intern, and my resident, my R3, my PGY3, would sleep the whole night, and I was handling all the patients. So at that point, I didn't raise any issue. I didn't complain or nothing. When I became senior, I complained about that senior myself. But that could be a situation also. Hey, if you are the intern, and if your resident is not doing the job and making you do all the work, or just sleeping the whole night, perhaps, what would you do? So that would be another scenario that I didn't hear anybody ask, but happened to myself. And I didn't really manage it well. I just said, okay, let me just do the work, and that's it. So again, you would say that, okay, I will talk to my senior. Hey, a senior, that I'm on my own all night, and it would be good if you can, take a few patients, and we can, divide the workload. If that doesn't work and there's any issue with them, he's not able to sleep in the day when he's off shift. Maybe there's any situational, maybe he has a situation, he has kids, whatever. But I would address it that I would be happy if you can be more available during the nights, especially during the night shifts when it could get a little heavy. If he doesn't cooperate, then you'd have to escalate. That's it. There's no argument about that. And in the US, it's different from other countries, that you really have to feel subjugated in other countries. But in the US, there's a hierarchy. You do respect your seniors. However, you need to deal with the situation as it is, and don't be scared of objectively handling a problem. So the important point is objectively handling a problem. And don't bring too much emotionality into the mix. Say it like it is, address it like it is. Okay. Anybody had this situation before?
No.
Well, I was usually the one coming late, so maybe someone else.
Well, yeah, now people know to report on you, okay? So everybody here.
Keep it out.
Yeah. So yeah,
So Dr. Umar, in that question, when your colleague is running late, is it okay to say like I would give I would offer my help if I can do for my colleague's situation, and is it okay to say I will express the concerns, right? What when he or she is late, and how it impact on our team performance?
yeah. You can say that, definitely. It impacts the team performance. For example, the example that I gave you, it impacted my team's performance, definitely. And second, I was a PGY3, and I had to make sure everybody. I was a team leader. I have to make sure everybody is online with everything, and they are prepared, and everything is ready. If the R2 resident doesn't help out, then everything falls on myself. So that doesn't work. So it could be different situations, but exactly, you can say that. You can emphasize, hey, can I help you with something? However, in a work environment, you're not going to be covering them for them being late for too many days. They're late once or twice. Okay, fine. Okay, I'm sorry, I was late. They can apologize, but if it happens more, you have to address it. Yeah. And you won't offer too much. Okay, maybe one day I'll look to cover you, but you have your own things to do. Okay. Everybody is a resident. Nobody's getting a free hand around here, right? right? But nicely, everything is nicely. All right. Okay. Next question that I think we should cover. And this question is in the program as well. So it's about handling conflicts in the workplace, right? So one person informed that they had this question asked, that there was a misunderstanding between your colleague. Maybe give me an example, or how would you handle that situation? So yeah, this question comes up a lot, fairly frequently, because of the fact that these things happen a lot, right, in the workplace. So this is a question that we definitely need to be prepared with. So what you can talk about is that, well, I do believe that my interactions with individuals really result in conflict. However, in high pressure environments such as medicine or any other residency, surgical residency, family medicine residency, anything else, conflicts may arise, particularly when there are misunderstandings in any nature, maybe task distribution, workload. I believe that the key to resolving conflict is through open communication and collaboration. And for example, I had a situation once when I was in my final year, when we were doing a sub internship, that we were in a very busy ER, and I felt that I had a lot more patience than my colleague, and I addressed it with the colleague. Hey, we are seeing that we're having a high census right now, and people are coming in through the doors every 10 minutes. Would it be okay if we work on this? The other colleague was very frustrated with the workload that they had, and they were unable to manage their workload. They may have had a sick patient here and there. But having that conversation, I realized that individual had sicker patients than myself. So I took it upon myself that, okay, instead of arguing about this much, I do have a patient census that is of a less sick nature. So I was okay with that, and we were able to amicably solve this issue. So rather than escalating a situation, I look to communicate and discuss. And of course, everybody is there to do their work. And we were able to calmly divide the tasks evenly. And the rest of the shift went out smoothly. So yeah, I think the goal with any of this would be to emphasize communication. If you're unable to solve a problem among yourself, then you will definitely escalate. You won't try to readdress the situation multiple times, because that will lead to an aggravation, and that will lead to confrontation. So if you're not able to handle a situation after one or two conversations, then you will definitely escalate. All right. So this came up with anybody else, or in real life?
No, not with me.
Yeah, you haven't worked too much. Oh, you haven't worked too much then, huh? All right. Anybody else? Anybody been asked this question in their interviews? No, that's okay. All right.
Conflict with a coworker. I got question from one interview.
Okay. How did they ask it?
Like directly, you work. I can see you have experience at different places. Have you ever had conflict with your coworker?
Right. Okay. All right. That's a very common question. All right. And I do believe I have 3 sample answers. So you can see something that suits you. Let me change the view. Let's see if it's, actually good. All right. So let's go over one more. I'm not sure if any of you were in this discussion before, because this question did come up, but it's a very common question. So this is about, we know that doctors are not really supposed to have relationships with their patients, right? And we were discussing that psychiatrists are never allowed to have a relationship with their patient, never, ever. A medical doctor, other specialties, technically they can have a relationship, but they have to cut off all doctor-patient communication, or cut off any doctor-patient relationship. If they, and then after a certain time period, they may date or have a relationship with a former patient. But it is always a tricky question and a tricky subject, and people have been fired. Licenses have been lost when doctors have had a relationship with a patient, and it's considered immoral and unethical for clinicians to have emotional relationships with their patients. Has this question come up?
I got one question regarding this. If one patient in your clinic asks you on a date, then what you will do?
Good question. Good question. Anybody else? It seems only he has interviews so far. So anybody else?
No,
Yes,
maybe
Dr.
they
Khan.
looked at him and they were like, "Yeah, this guy's gonna get asked out a lot." So
Maybe he's handsome and dashing. I don't know. Huh? Okay. More handsome and
Yeah,
dashing than
I'm just
anybody else,
yeah,
huh?
I'm sharing the information, right? Like, so
Okay. There actually, we'll talk more about this because there are many different aspects of this question. And we need to know that you cannot have a relationship with a patient.
Dr. Amar, I have a question, please.
Sure.
Yeah, if somebody asks and they're like, "What would you do?" Do we predominantly mention the fact that we would be very kind to our patient regardless of whether they ask us out or not?
Um, yeah, I mean, you would be kind. Yeah, you could say that. It's not that you cannot say that, but I don't think you need to say that in this question. That you will be kind. Um, that goes regardless of the situation. You need to be kind nonetheless with any situation.
So we just say we'd tell them sternly that this is not professional for us and we can't really embark on a relationship with our patients.
Exactly. That's definitely part of it.
Okay.
Exactly. And we'll address both these questions. So beginning with, if you saw a senior being involved in a relationship with a patient, how will you look to address that? So again, this is about ethical standards of the medical profession, and we have to definitely know about this. So if I found a senior, and the thing here is, so the thing you need to keep in mind is that nowadays it's very few people are in private practice. So if you get in trouble, you can handle it yourself, or you may not fire yourself, right? But nowadays, very few people are in private practice. I think 70% of the doctors, even more, are employed. That basically means that you can be fired by your employer. There's a guy, MBA guy, sitting on top who can fire you. So, and if there's an investigation, so investigation goes everywhere. When there's an investigation, everybody gets investigated. You have to keep that in mind. And the way you would answer the question, let's say you are a junior or anybody else or a colleague. So if I found a senior doctor was involved in a relationship with a patient, I do recognize that is a very serious ethical violation, and we have to definitely maintain professional boundaries. And this is all in line with protecting the patient. We cannot have any emotionality happening while treating a patient. And I will look to discreetly confirm and observe the situation. I would not jump to conclusions. If I see something that is very concerning, then I would convey the matter to the hospital's ethics committee, or follow any institutional steps that they have in place for reporting these incidences. And yes, I do believe we have to maintain professional boundaries. I respect my colleagues. I would have respect for my seniors, but I definitely believe that this sort of situation cannot be happening. And I will let the ethics department or anybody else, take it from there, and they can evaluate. I would look to avoid confronting the individual myself. I think this is something that's much beyond myself, and it relates to patient care and patient well-being. I would proceed with this situation as such. Okay. So a lot of people would say that, hey, why don't you talk to the colleague to cut that? Hey, can you stop this from happening? Can you not date your whatever, he or she? right? Um, that could be in a way, okay, he's your friend, he's your, you know him or her, and you don't want them to make this mistake, or you just keep quiet. But let's say in the future something bad happens and they break up, right? And that person, that patient knows that, hey, this was illegal. He should not have dated me. He or she should not have had a relationship with me, right? That person, to get back at the person, may complain to the hospital. Hey, we had a relationship. Now that we are fighting, we had a relationship. So that will be a big concern. And when the investigation opens up, they found out, oh, you also knew that he or she was actually having the relationship, but you also knew that and you didn't bring it up. So he or she's going to get in trouble, but you're also going to get in trouble because you knew it. You see? Comprende? Spanish for understand? Yes, no, maybe so?
Yeah, Dr. Umar.
Right.
It's pretty clear. Don't do it.
So your point about that if a patient is approaching you and is showing their intentions, definitely, as Abdullah, you had mentioned that you will be very professional and say that this is definitely not allowed, and we are in a professional environment, and you're my patient and I will deal with you as such. So that is definitely how you would say it. Depends how much the patient is approaching you. What you would do for any future situation, any future visits, is that you would have a chaperone in your visit, in the office. Okay. You will have a chaperone. And you will always convey that you need to have a professional boundary. That's it. And you will have a chaperone with you. The way they ask this type of question is, that's one. The other way they can say is that if you suspect that the patient is coming into your clinic making complaints that are not really medically objective complaints, and they are just talking more and being more affectionate and saying nice words to you, if you suspect anything like that, even if the patient is not overtly communicating to you about their feelings, if you suspect something, you would again have a chaperone at all times.
No, I get that. That's perfect.
Right? Okay. Chaperone at all times. Any questions regarding this?
Yes,
Anybody
Dr. Khan, I have a question.
Situations like this. How do you handle it?
Can you hear me, Dr. Khan? I have a question about this.
Sure, yes, Faisal.
When you say that if a situation like this arises, do we have a chaperone in the US when we go and see a female patient from the start? Do we not have a chaperone?
So it depends. So if it's a regular visit, and you're not evaluating the private parts, no, you don't need a chaperone. If it's a regular visit, you're not evaluating the private parts, you don't need a chaperone. With any evaluation of the private parts, you need a chaperone, male, female, both. More with female. And chaperone basically means you can have anybody. You can have the nurse or anybody else, just a second person to be there to witness.
They have to be female, right, Dr. Umar? They can't
female. Yeah, female.
Right, Dr. Umar. That makes sense. Thank you.
Another question happens, ethical question that comes up, that you have been dealing with an abusive patient. Okay. The patient, you see all types of patients, right? You have family members who are aggressive, abusive, forgetful perhaps, or forgetful on purpose, and histrionic, emotional. How will you deal with a situation where the patient is very aggressive and rude, and you've had previous encounters with the patient has acted in a rude, verbally abusive manner? How will you deal with the patient? Any idea? Any?
I think first we should go ahead and talk to the patient to diffuse the situation verbally. If that is unsuccessful, that attempt is unsuccessful, then we can probably bring in the security or any other person and let them stand nearby.
Exactly. So yeah, so different. Yeah, definitely. If they're only verbally abusive, right? Or they're histrionic, emotional, or physical. So if they're histrionic, very emotional, you would have a chaperone. If they're verbally abusive or physically aggressive, you would have security. Okay. So you will, I mean, you probably have, all of you have experiences where patients are, it does happen more with emotionally with female patients, that you may be afraid that, okay, they may make something up. They may make a complaint that you did not do, that you touched them on improperly or something similar, which you definitely did not do. So whenever somebody is emotionally unstable, you have the patient's nurse at the bedside as well. If they're physically or verbally abusive, then you get out. Your safety is important. Call in security. That's it. All right.
One question, Dr. Umar. If they say the patient is upset and abusive, and how you gonna tackle this situation? So what's gonna be my answer?
The patient is upset and abusive.
Yeah, like upset. He's upset and rude to you, and how you gonna tackle this situation?
So okay, you will always say that demanding patient, right? So yeah, it definitely happens that there's in the hospital, people are in significant distress and they have multiple things going on, and they may not be fully appreciating what is being communicated, and there may also be a communication gap from the clinician side. And you have to understand that patients are going through a lot, and we are there to serve them. If there's an issue with the patient, it definitely could be that the patient is not fully able to grasp the situation. However, it could be a deficiency from our standpoint or my side, that I was unable to communicate with the patient in a much more approachable manner, in a more layman language. So I would definitely ask the patient that, hey, I understand your concern and I understand that you are frustrated. May I know how I can help you out and how I can address your frustration? Is there anything in particular you're concerned with that I can address to you right now? Okay. So you would try to communicate with them and talk to them, be nice and cordial without raising your voice at all times, and see if you can address their situation if they bring up a concern. If they bring up a concern, I will amicably look to address it in layman terms and try to come to where they are, try to come to an understanding of what they're able to understand and comprehend. And I will look to try to talk at their level. So this is only if somebody is just being upset, histrionic, emotional, hey, I don't understand anything. What's going on with me? I don't know anything. Right? That's one. But they're abusive. Hey, shut the F up or get out of here. That's a different story. Then you call security. Then you just call security. So yeah. Yeah. So yeah, that's it.
I have two questions, Dr. Umar.
Yes.
And number one, regarding the relationship one, you said that in case you find out that your colleague is involved in some relationship, and you have to report that. In case we answered that we confront our colleague and ask them, like, you're not allowed to do this, and etc., etc., and then in case they don't stop, then we escalate the matter to the higher authorities. Would that be a right answer?
In a relationship, no. In a relationship answer, you will not talk to them yourself. If you see something, you just report to the ethics committee or however is set up for that institution. That has been my understanding, and that has its reasons. I think what I discussed, the reason was that if for some reason, the person is your friend, you would, in a way, if you approach like this, that you would talk to your friend about it, you will be very reluctant to complain about your friend. So remove this emotionality from the beginning. Remove these mind games from the beginning. If you see something, you just have to let the ethics committee know, or the whatever procedure that they have for the hospital.
Okay. And the second one, you said in case the patient comes to your clinic and they want to get involved in a relationship, can we say to the patient, like, give them some time to arrange another doctor or physician, and like stop the doctor-patient relationship if we feel that patient is not taking a no?
Yes. So if the patient is not taking a no, you
Yes.
cannot abandon the patient. You need to
Yes, yes.
you have to have somebody else. Definitely, you're right. You will always have a chaperone, and you would, of course, nobody after the patient realizes that okay, the doctor is all business, and there's a chaperone, then nothing significant will happen, of course. Um, um, and then you would proceed with finding the patient another physician. Once you have
Yes.
found a patient, found a physician, and communicated about the patient, then you're all good. So it
Okay,
happens
okay, got
is that it happens a lot in clinic. It also happened, and this could be another question. The patient is in clinic, abusive to you, arguing, calling you names, whatever, whatever. You cannot say, I refuse to see the patient. You cannot do that. You cannot say, I refuse to see the patient. I don't care. Whatever happened, patient dies. I don't care. You cannot do that.
Yes, yes, of course.
And you have to find another accepting physician. Then you can let go of the patient.
Okay, okay, got it.
All right. Good question. Anybody else? Any this?
I had a question, Dr.
Yeah.
Umar.
Uh-huh.
So, what if they ask you, how will you verify that the relationship is actually true and it's not just your suspicion?
So this situation only happens if it is very obvious. Okay.
Okay.
And there are certain environments, right? The hospital environment is one. It would be very obvious, and they would not be able to hide the relationship. In clinic is different. If you are working in a group clinic, is different. But many of these episodes or these things in real life don't happen too much. To be honest, they don't happen too much. But if they do happen, people only find out when it is beyond a certain limit.
Okay,
that you
got
notice,
it.
okay, this, right? It's not going to be very
Understood.
obvious unless it has gone a couple of steps. They are now really in a relationship, right? They're
Okay.
emotionally involved, all of them, both of them. Then you will only find out. Usually you won't find this out because, yeah, it will be a rare occurrence that you will find this out. However, if it does happen, you will see it. Oh yeah, okay, this is strange, because you're human, right? You can see what's happening. Okay, they are, being too cumbly, whatever. Or you're seeing them outside, or you saw them somehow at a restaurant together. But again, you won't know about it unless he or she tells it to you, or indirectly somebody else mentions it. Because so for this to happen, there are many things need to happen. You need to know that patient is his patient as well, his or her patient. There's very little chance that you will know about it unless you are all are sharing patients, or that is your patient as well as his patient or her patient, that you are the gastroenterologist, and he is seeing the other doctor who is a pulmonologist, and he says something that, hey, I'm dating him or something, right? So this situation will be obvious to you in a way. So yeah, different situations, but whenever this happens, this will be very obvious. Okay.
Okay, thank you.
All right. So
Dr. Umar, what if you I'm sorry to cut you off. What if you find someone outside the hospital, and it's outside the hospital premises, and you see someone and you clearly know that they're hanging out with one of their patients in a romantic setting? Would that still be your responsibility?
Yeah.
Could you pretend that you never saw them?
Well, make sure they never saw you, that they never know that you know about it.
Yeah, okay. Just to avoid the whole hassle.
Just don't look at this. They don't need to, so for example, again, everybody breaks up, right? Especially a lot of people break up, right? So they know this is illegal. Both of them know this is illegal, usually. And the patient may complain if they're really upset at the doctor that, hey, he or she was dating me, right? And oh, Abdullah also knew about it. So just, yeah, if you don't know, don't know. That's good.
Perfect.
Omer?
Yeah, Dr. Khan, I have just one question pertaining to the same scenario. If a patient shows a relationship interest in a physician and the physician engages in direct communication with them to counsel them against it, what's the right way to do it? I mean, should they say phrases like it's professionally unethical or inappropriate? What's the right way to counsel them?
That's it.
That's
It's
it.
inappropriate and unethical.
All right.
You are my patient, but you have these feelings. It is probably not proper that we maintain our doctor-patient relationship. I would love to connect you with a colleague of mine or somebody else that you may want to pursue your care further with. And we can work on a transition of care.
Right, sir.
But all of these conversations, you need to call a chaperone immediately.
Understood.
Okay.
Thank you, sir.
All right. Anybody else? Important question.
Hello.
Yes, yes.
Hi, Dr. Umar. I just wanted to ask, like, if somebody asks you that, how would you know that you have satisfied the needs of a patient? How would you know that you're fulfilling the needs of a patient? How do you answer that?
Okay, that's great. So after every visit, this is what you're supposed to do. Have I addressed your concerns?
Okay.
That's it. Is there anything else I can help you with?
Mm-hmm.
Have I addressed your concerns? Is there anything else I can help you with? That's routine. That's supposed to be routine with any visit.
Mm-hmm.
That's any visit. Any visit. Anybody else? Any other questions you're getting? Any other issues?
Hello, Dr. Umar. One of my friend got the question that what if you suspect that the doctor has a relationship with the medical staff, like nursing staff, what will you do? So he was like blank out and this situation.
No, okay. So a lot, you would say that relationship in the workplace, I would frown upon this. And a lot of hospitals have policies. You would say that definitely there's an employee handbook, and we will follow the policies. We will follow the policies as delineated by our employee handbook regarding relationships among colleagues, and we will look to strictly follow that. Some hospitals, it's people will get into relationships, and that's okay if it's not your patient, if it's not affecting your superior or subordinate situation, then it's reasonable. But if it affected a situation that you are providing unnecessary favors, or they're getting unnecessary favors, being able to come in late, getting that extra vacation, that cannot be happening. However, I will of course look at if there's a situation such as this, I will review the policy of the hospital and the establishment and see what is the protocol. However, I do frown upon a relationship within the hospital. Although, if I see there is a relationship happening, but that relationship is leading to unnecessary favors, then that I believe would be unfair to the whole hospital system and other colleagues. I would definitely bring that up to notice to the ethical committee.
Yeah, thank you, sir, doctor.
So because people will have, you do find your spouses or people in the hospital, that's fine, but it should not affect the workflow at all.
Okay.
It should not affect the workflow at all.
So, Dr. Umar, if they ask you if you found your colleagues, your other resident in a relationship, so this is gonna be the same answer?
Yeah.
Like other resident and you find your senior resident and your colleague is in a relationship. So the answer is I will look into the hospital policies if they getting the unusual favors to each other, or it's affecting the team.
Exactly. Your issue is only unusual favors. They're consenting adults, perfectly fine. Okay. But your issue is if the guy is a third-year resident and the woman is a first-year intern, and she's getting the best shifts and everything else, that's the problem. If they are doing the job properly, there's no problem.
Okay. Thank you.
Okay. Okay, so these questions are coming up a lot, huh? These questions are coming up.
Yes, this season they are asking ethical questions rather than the robotic ones.
Right.
And the medical knowledge related to medical knowledge too.
They're asking medical. So everybody has prepared a case, right? Everybody has
Yeah.
at least a case.
Yeah.
Right.
I think so.
So basically, those medical knowledge questions are about being able to present a patient. That's to my understanding, be able to present a patient. And most of us, whenever we come from, different countries, we have done some work, house officer or medical officer or whatever. Some people more advanced. So there's looking at if you're able to present a case.
Yeah, now they are asking you to present any case, like not the interesting case. Last year it was like everyone was asking everyone that tell me about any interesting case. Now they are asking present any case, like in a shop, like you are in rounds.
Present any case.
Yeah.
Okay, exactly. Yeah, exactly. Present. They want to know if you can, because you will, when you are a resident, right? Intern, you are expected to be able to present a case. There's no like easing in.
Yeah, that's why they like last year, one of my senior told me most of they got the resident who were not able to like present the case even in the rounds. So now these programs are looking at those candidates who can at least present the case, even a simple case. So that's the main reason behind it.
Right. You know why I'm thinking they're noticing? Because back in the day we had the CS examination, right? So we would we were not presenting a case, but we were going through the US way of asking questions and history and getting all the input from the patient. And we were at least writing notes, right? In the CS exam, the clinical skills exam. And that's, I think people back in the day before COVID were a bit more prepared from the US standpoint. So I think they may have noticed this in the last couple of years that people have not been ready like that. So that's why I've always emphasized be able to present a case, past medical history, review system, pertinent vitals, pertinent physical exam findings, important laboratory results, and assessment and plan. Right. So just have to go through the whole process. Okay. Anybody wants to take a jab at answering a question?
Yeah, I can go ahead, Dr. Umar.
Okay. Let me come up. Okay. Okay. After we get your answer, I just want to talk about a few questions that you can ask the program. I think that's sometimes important.
No, we can do that before as well if you're comfortable. Whatever you want to do, Dr. Umar.
Okay, so let's just share a few questions that you should ask.
Perfect.
I know we discussed this in previous sessions, so I won't repeat the ones we already did and the questions that I have in the program, the 12 questions that we have in the program. So I'll share a few more that may resonate with you guys a little bit more. I think it's a reasonable question to ask. And hey, as the program director, if you had to just pick one, what is your program's greatest strength? Okay. So just keep that in mind. That's a reasonable question. I would not ask them for the greatest weakness. I want them to feel happy about themselves when they're talking to you, okay? And then, I heard about that you had a feedback program and a mentorship program as well. I just want to have if you could share a bit more about how our residents evaluated. Is there a formal evaluation? How is that particularly done? Okay. Okay. So then what you could ask is that I think I had one of these type of questions in my 12 questions, but it's slightly different. Is so I love the program. I love the different aspects and the teaching and everything else. I'm just wondering, since we are in a community and a community-based program here, what type of community service initiative does the residency participate in? I would love to play a positive role in any of these initiatives. Okay. So in a way, the way you're asking a question is that you are interested in doing things. You are putting yourself forward as a positive person who wants to do things. Right? So yeah, then what else? Okay, then maybe a personal question. So I see you're so enthusiastic, and I love the energy that you're bringing to the table here. But just on a personal note, what has been your favorite memory at this program? If you can share that, that'll be great. Okay. Positive question, not a typical question, right? All right.
Umar, how can we ask question regarding simulation training?
Simulation. Okay. So many will probably mention it, that they have a simulation lab.
Mm-hmm.
They have mannequins. So at least the ACLS and the BLS simulation training will happen before July 1st. Most programs, they bring you in a week earlier to go through their simulation lab where they have ACLS and BLS. But now, especially the surgical specialties, they may have more AR and VR technologies to support that. So it depends on where you're applying. I wouldn't ask much about if they don't have AR, VR setups. I mean, you would probably know it because that would have come up on their website or in their presentations. Because this is something that is a little bit expensive, and a lot of programs may not have, put in money towards these type of facilities. So, if you know about it, if they mentioned it, then if you know about it and they mentioned it just briefly, then you can definitely ask that. I love the fact that you have this simulation program. Can you share a bit more details about what's possibly included? I have learned how to place central lines and do lumbar punctures before, but I would love to know what we will be learning at the simulation lab. Okay.
Thank you.
Something similar. So yeah, you guys got a few more questions that you can possibly ask. Okay. All right.
Dr. Omar, can we ask the question, biggest challenge or any challenges that you like to share since you became the program director or something like that? Would that be okay?
That is great. That is great. Yeah, that's a good question. Again, an open-ended question and giving them the opportunity to talk about themselves. Okay.
Okay.
Yeah. Anybody else?
Yes, Dr. Khan, I have one.
Uh-huh.
If the program has some in-house fellowships, can we go ahead and ask the program director if they are planning to introduce other in-house fellowships in the future as well? Should we ask it or not?
Well, if they would already have mentioned it. Right? If they would have already mentioned it. I would think they would already mention it.
Right. So that's not the most appropriate question to ask.
Probably not the most appropriate question.
Right, sir.
Okay. All right.
And can we ask something like, what advice would you give to your young self or to me as a senior who's going to like start their journey in US?
Very appropriate. A very good question.
Okay. Thank you.
Very appropriate question. Okay, Rabia has a question in chat. I have a question. How to answer a question that if I see a colleague has given a wrong dose? Okay, so that's a very good question. Again, a scenario-based question that somebody has made a mistake, right? So you will address it similarly because this is not that you will go directly to your superior. You would say, hey, Dr. Smith, I saw in the chart that you had given this dose, but the renal function is poor. Maybe you want to just keep a close watch at it. Okay, if that person, if your colleague says, oh, okay, thanks for pointing it out, I will handle this. I will take care of it, and we will address it properly. And I will discuss with my attending as well. If there's something like that, then it's fine. If they're reluctant, then you go to your superior.
In this scenario, Dr. Umar, do we need to approach the patient to see if it's if like any complication happening, or like would like to inform the patient like this is wrong, and if you feel any complication, you can go to the ER and stop the medication, or just see where the prescriptions are to check on pharmacy something? Do we need to do that or not?
I would not go that deep because there are so many scenarios that could happen, right? If that colleague is, you are the same resident team, right? So you won't go behind the back of your resident to complain about the resident to the patient.
Okay.
So you would have the resident, him or herself, address it, or the resident is reluctant, you will go to your attending.
So no need to approach the patient.
No need to, because so the hospital is always worried about liability, about being sued.
Okay.
So if you are doing a blame game and going directly to the patient and saying, hey, that guy messed you up, that guy gave you the wrong dose, the patient may complain to, or file a lawsuit. I mean, if something bad happens, right? So you need, so whenever you make a mistake, you talk to the patient. This is what happened. I apologize. We are looking to fix it, and we see that there's no adverse event happening, but I want to let you know about this, right? So that is something that somebody else needs to do. If they're unwilling to do that or are brushing you off, then you have to talk to your superior.
Thank you.
Right.
Hello, Dr. Umar. I have another question. Like program, I have interviewed the program doctor went to the outreach program, which is not related to the hospital.
So, sorry, he went to an outpatient program?
Outreach program, like outreach community program. So, but it is not related to the hospital. Can I ask him about his experience there? I came to know from his profile, like Facebook profile and Twitter profile, that he went to that the outreach program.
So in what sense would you want to ask him that question?
Like how was his experience there? So it's to try to communicate with him, connect with him personally.
Are you I think you have some other questions to ask. I think you have other questions to ask. I think you're trying to bring out something that, yes, you notice about his, but it's not directly relating to the residency needs. Then I would not really ask it.
I'm just confirming because I was searching about the program director. He went from Ecuador to do an outreach program in his own country because he's also an IMG. So I just wanted to ask him that.
Okay, so it's not a program in the other part of town.
Yeah.
Okay, the way you will ask it, I see what you're saying. Hi, Dr. Smith. Yeah, great. I just have one more question, and it's about you personally. And I saw that in your profile that you opened up a clinic or did welfare work at that location. I'm always interested in knowing how people are able to help with their medical knowledge. How is that experience? Maybe that will help me out in the future.
Okay, sounds good to me now.
Right.
I was confused between that. Should I ask that question or not?
Yeah, you have to frame it. You have to frame it properly. That's it.
Okay.
That's it.
Thank you.
Okay. All right. Anybody else?
Hello. Yeah,
Yes, Rabia.
I would like to just add one of the questions and one other point. So recently I had an interview, and the question I asked from the program director and from the other faculty as well was that what kind of learning or experience opportunities should I get involved into in the coming 6 months so that I get best prepared to start the internship here at your program. So they really liked it, and they are tell me whatever they want, whatever the difficulties they are facing with the current residents. Like program director said that they don't have a lot of primary care practice experience and they don't know what it is when they're coming from outside US and many other things like that. So I told her that I'll try to get involved and get that kind of experience. So she really liked it.
Great. No, absolutely. Please take a note of it, everyone. That's a good question to ask. That's a good question to ask. Great. Excellent.
Thank you.
Yeah, reach out to me. Send me a message about what questions you have had, and we can look to address it in future sessions. And any confusion, any question that you were not sure about, let me know, and we can discuss it in future sessions.
Yes, sure.
Hello, Dr. Umar. Same question I asked one of the senior and program director. Can you ask that? He told me that you should try to learn Spanish, nothing else like that.
No,
It
yeah.
was a Chicago program.
I know basic medical Spanish, basic medical French. Okay. Spanish. ¿Cómo te va? Bien, me alegra. Dolor aquí. ¿Ha tenido ese dolor antes? Falta de aire, dolor. I mean, I know basic medical Spanish. Similarly, basic medical French. So because where I was, we had about 20% of the population was Spanish, and we had some French Creole patients there as well. So so you need to, you pick up a book or something similar and learn a basic Spanish. That's fine.
What is that? Which one is the recommended book for basic Spanish?
You can find a lot. There are apps nowadays. There used to be cheat sheets. This was 10 years ago when I was in residency. There's cheat sheets. There's so many products out there. I mean, I haven't looked at it again, but once you learn in residency, that just sticks with you. Yeah, good to ask. Good question to ask. Any specific language you want to brush up on, or at least get the basics around? It's a good question.
I was also asked the same question, but she directly asked me that, do I know Spanish? So I said, not yet, but I am looking into it. I'm planning to learn it. I'm taking the initiative for that.
Definitely. Yeah, just say that at least the basics, English and communication. I'm looking to hasta luego, hasta mañana, basic communication, pleasantries of a language. It goes a long way with your patients. It goes a long way with your patients. But of course, you will open up, you will get the translator in. Unless you are proficient, this is largely for emergencies and just to get to connect with people. But in most situations, if you're not proficient, you will get a translator. Nowadays, their tablets are similar devices in the hospital that you can use, and very easy communication to communicate through a translator. But it's always good to know these things, so sometimes you can communicate with the other translator. Good point.
Dr. Umar, I have one question that one of we saw in Apna group that one colleague mentioned that he was asked that teach me any topic, like non-medical topic, how we responded when he told recommendation for it.
Maybe I didn't get the question.
Teach me any non-medical topic, like they are asking to.
Oh, in the interview.
Yeah.
Okay. All right.
Someone posted in Apna group too.
Okay. No, yeah. So if you, for example, if you know photography, perhaps, or if you know oil paintings, those are traits that people should know. I mean, some people know about. Or what else? And
is it okay to say
hobby
yoga?
That you have that's different? Or if you had some experience, non-medical, you did finance, you did accounting, perhaps something that that you have not, that is outside of medicine. Hey, I can talk about accounting. I can talk about finance. I can talk about coaching. I was a cricket coach, perhaps. What's the basics of coaching? Being a cricket player is one thing, but be able to coach is a different thing. Or I know how to net. I know knitting. I mean, I don't have it right now. I can give you the principles about how to weave it properly.
Embroidery.
Embroidery, right? Embroidery, anything.
What about yoga? If I say I can teach you some yoga, like inhale and exhale.
Sure. You know karate? Yeah, I'm gonna show you karate moves. But my pant may rip if I do any of that. So, and yeah, that's a good point. Yeah, I think that's something naturally that you know about. Talk about it. Good question. All right. So you're seeing that it's people just want to communicate, right? And that's it. That's it. All right, guys. Anything else for now?
Yeah, I was also going to, please go on.
Sorry.
Yeah, yes, please go ahead.
Okay. So my question was that does it matter what date you're scheduling your interview for? Like, is it early in the season or late in the season? Does it matter any manner?
Right. So that's a good question. I would say depends. If you are well prepared, it's better for you to be early, because early people, most candidates early on are not prepared. If you are well prepared, it's better to be early, because later in the season, everybody will be prepared. Okay. So if you are a good communicator, I would say do it early.
Thank you.
Yeah, because they will see, okay, this guy ranked from that session, from that block, from the early on in November, this guy or gal was doing better than everybody else. So that person got a better score. So they will look at that.
Okay.
All
Thank
right.
you.
Thank you. All right. How are we?
Yeah. So I was asked a question that I have good board scores. So what thing I should what would I like to attribute that why I had these good scores, or what is the reason? What would I attribute the good scores to?
Okay, that's an easy answer, right? So you could say, well, thanks for noticing, and yeah, I definitely prepared well, and I had done well previously as well. I just do my best, and yeah, thanks for noticing, and hopefully, I carry my medical knowledge into residency, right?
Yeah, I addressed it in a similar way and also
Great.
said that my basic medical knowledge from my college years, everything contributed towards it. And I really worked hard, did a lot of practice exams and gave it some extra time.
Good. Excellent. Good. Excellent. Now, hopefully then they ranked you high then. They pointed it out, so it means they noticed it. Good.
Yes, they did. Thank you.
Good. Okay. We got at least one person matching, right?
We are not sure. They say to
No,
everyone, I
fingers
read it on
crossed.
the Apna group that they say to everyone that we will like to see you in July.
Well, anyways, good. Anything good, you just take it. Good. All right. Anybody else? Situational questions, ethical questions. But I would say still, you need to still get the basic questions right. You just can't fumble on those questions, okay? They may ask you, typical questions also. Just can't fumble on them, right? All right. All right, guys, good talking to you. And yeah, send me any question that you have that you mentioned. Let me see. Let me send, if somebody doesn't have my contact for some reason. Where is this chat? Where is chat? Chat. One. Okay, so yeah, thanks, guys. Yeah, more sessions coming up. And yeah, thank you so much for your time. And best of luck for your interviews. Thank you so much.
Thank you, Dr. Umar. Thank you for your time.
Thank you.
Have a good day.
Thank you. Bye.
Thank you.
Thank you, Dr. Umar.
Thank you, Dr. King.
Thank you, Dr. Umar.
Bye.
Dr. Umar, I sent you a message on private. Can you please check and
On Facebook?
On WhatsApp.
Okay, WhatsApp. Yeah, I don't look at Facebook.
Right.
Okay, thank you.